We at Biogen have the great interest to take developments further, not only developing new medicines, but also developing new tools to better understand diseases. And so specifically, we at Value-Based Medicine are trying to develop a platform that will enable us to better understand MS as a disease and will enable us to improve the way how we treat our patients with this disabling disease. Value-based medicine is a group within Biogen that is actually trying to understand how we can improve our understanding on the value of what we are doing to our patients. This means on one side, what is the value of the drugs that we're using? On the other side, how does this translate into something meaningful to our patients? The overall program is the development of a learning health system, and so we're trying to set this up in the context of multiple sclerosis right now. The program that we are talking about is called MS Paths, and it's a partnering with academic sites around the globe. And by that we are implementing a standardized clinical assessment tool. We're going to use a standardized MRI measurement, and we supplement this with biomarkers and other sub-studies. And by that we try to generate a huge data set prospectively, and we'll then follow those patients over the course of their disease, and we'll see how those patients actually perform. The advantage of that is that in real time the treating physicians gets all these informations of the standardized clinical and standardized paraclinical assessment, and by that the physician has a much better view on what's happening with the patients and can then decide whether, for example, a treatment switch needs to be implemented, yes or no. So it's completely independent of any drugs. It's just a platform we share with academic sites to figure out what is the right drug for the right patient at the right time. I mean, patients have to sign in to be part of this program. But from our experience before and with similar approaches, but not as good, patients are more than happy to participate, because at the end of the day, we hope that this will translate into better treatment for our patients. It's a learning health system, so we have a feedback loop in there, and so physicians can actually share their experience, and then the physicians will actually see what similar patients would have received or how they would have performed at one point. So we believe that this will actually kind of translate the science from clinical trials to clinical practice. Standard kind of a platform core set of data on the disease, and then what we're constantly capturing are clinical assessments of motor function of the upper or lower extremities. So similar to what you do with a MSFC, we do a cognitive test, we do a visual test, and we ask patient-related outcomes, so for quality of life and these things. So that's relevant, it's standardized, and so we can actually track what's happening over time, and the physician gets a visual feedback, and as I said, it's a learning health system, gets a feedback hopefully at one point to see how the patient in the overall pool of what we've been generated would actually be performing. Anything you add on top of what doctors have to do, you can't actually ask them to do that because time is limited. So the tool that we are implementing is actually meant to be self-administered by the patient. So by that, the physician will actually save time. So it will actually, from a time efficiency perspective, it's actually better, because once the patient enters the room to the physician, everything has already been done. So you have the entire clinical assessment will be visible on the PC or iPad or whatever you want to use. And the same holds true for the MRI measures. Will all be available in real time. We are negotiating with various academic sites and various hospitals at the present time. Our goal is to have like 15,000, 20,000 or more patients being enrolled in this program. The hardware we were using, this is what we call the MSPT. That's the device that's actually capturing all the clinical measures. This will be provided. And on top of that, we're going to implement or we're going to change the algorithms in the MRI protocol to some extent. So it's kind of a software update, if you want. No, it is a multinational effort because we have to understand how the care that's provided differs, and so it's going to be interesting to look at that, because MS care, even within the United States, is different from side to side, and so we are trying to get a better view on what's really happening on this planet. So it's a global effort, and yes, we try to leverage for that. Well, the reason why this was chosen is that Biogen has such a huge portfolio of different therapies available for treating MS. This is kind of the best learning platform we can use. And so given the experience of Biogen as a company with 20 years history or even longer of being kind of the key player in the MS field, this is kind of the driving force for that.